As we're all navigating the COVID-19 pandemic, it is now more important than ever to have a healthcare plan that works best for you and your family. Joining us today to help is Chief Consumer Officer at United Healthcare, Rebecca Madsen. Rebecca, a big good morning to you. But I think oftentimes, we hear open enrollment, and a lot of us don't know exactly what that means. Can you explain that to us?
Absolutely. Thank you for having me here, first of all. Open enrollment is the time of year. It's usually about a 6-week period for employer-based plans, Medicare, and state exchanges when you can pick your plan for the coming year. And we know about a quarter of people spend less than an hour on the process. Now more than ever, it's important that you have good coverage. We've seen with everything going on in the world. So take some time this year to pick your plan for the coming year.
Okay, yeah, so picking the plan, the word picking, right? And you say people spend an hour looking. We have more time at home, most of us, so we have time nowadays to actually research this. Do you have any tips on what we should be looking for?
Absolutely. So the first thing is looking at your plan today. Do you feel that you need more coverage than you had? Has something changed in your own life that you need to make sure that you're covering yourself and your family in a different kind of way? Are you sicker, healthier? Do you take more medications? Do you have a planned procedure? Are you pregnant? So just take stock of where you and your family are in your life. The second thing is looking at cost. This is not only the premium or the amount that you pay out of your pocket every month for insurance, but the deductible, the amount you pay before your coverage kicks in. Take a hard look at that, because we see many people get cost surprises because they don't pay attention to the deductible. The last thing is coverage. Make a list of the providers you see, your family sees, the medications you take. Make sure that they're in network and on the formulary to minimize your out-of-pocket costs and get quality care in the year ahead.
So Rebecca, I called yesterday to make my son a dermatology appointment, and they asked me whether I want to do it virtually through Telehealth or I want him to come in. And it made me think, how are we doing that with our healthcare system now? Is that changing the way things are done in terms of, open enrollment and what our healthcare policy does for us?
Absolutely. One of the biggest trends that we've seen during the COVID-19 pandemic has been telehealth. When people weren't able to go to their doctor office for non-essential care, or they were frankly quarantined and in their home, a lot of people started using telemedicine. It's a great way to get care. Not only can you see a provider and have a conversation, they can often diagnose you. Dermatology is a terrific example. They can also write your prescriptions. You can send pictures to the provider, and you can have a real visit in your home through a phone or a tablet or on a website, and it's often much less expensive as well. You can have your costs covered by many insurance carriers during COVID-19, but even in normal times, it's a more effective way to get care from a cost perspective, and it also is very accessible and very safe.
Okay, great. We're all about saving money, most of us, right? So how can we actually save money on these healthcare plans?
So there's two things to look for. One is wellness programs with incentives. We know, especially now, 30% of people say that their diet has gotten worse during the COVID-19 pandemic. We also see people walking more. You can often earn incentives for doing that, usually on average about $800 a year. 70% of employers offer wellness programs. So look for those, not only for your health, but for putting money in your pocket. The second thing is health savings accounts. People often overlook these. They think it's really complicated. It's very not complicated, actually, and it's a great way to put money aside tax-free. You put it in tax-free, it accrues interest tax-free, and you can remove it to pay for qualified medical expenses without any tax implication. So with people not putting more than $1,000 on average aside for healthcare expenses and so much unknown now, it's great to leverage a health savings account to save money in a tax-free way.
Fantastic. Rebecca Madsen with United Healthcare. Thank you for this great information. Where can our viewers go for more information, Rebecca?
They can go to uhcopenenrollment.com. There's helpful information and tips to guide them through the process and hopefully make it a little bit easier this year.
Fantastic. Thank you.
Of course. Thanks for having me.